I am Dr. Robbie George. I am the Chief of Vascular Surgery at the Narayana Health City in Bangalore. And I'm just going to talk to you about hemodialysis. Now, why am I as a vascular surgeon talking about hemodialysis? Is because as a vascular surgeon, we are involved in creating something called arteriovenous fistulas and in providing access for patients to get dialysis. And we've seen there's a lot of misconceptions and misunderstandings regarding dialysis. So firstly, what is dialysis? Dialysis is a process by which we are removing all the toxins and the poison in the blood for patients whose kidneys are unable to do that. How is dialysis done? So essentially what you have to do is you have to take out the entire blood volume in the body, put it through a machine, wash it and return the blood to the patient. Now obviously we don't take out all the blood at one single time. It is taken out over a period of 3 to 4 hours. And to do that, you need to have a tube or a needle that you can put into a blood vessel where you get high flow of blood, which you can draw the blood and return it back quickly. And this is essentially what the process of hemo, which refers to blood, dialysis means. So how do you achieve this removing and returning of blood is where we as vascular surgeons get involved. So when it needs to be done urgently, the commonest process is that you put in a small plastic pipe into the neck, what is called a catheter, into a blood vessel in the neck through which you're able to draw and return the blood out. So you can have what is called a temporary catheter, or you can have what is called a permacath, which is a catheter which goes from typically the chest wall and then goes into the blood vessel. The difference between the two is one is more likely or at risk of getting into infections and blockages, and it is less likely and less risky for the permacath option. However, that being said, in non-emergency situations, the option of choice to do dialysis is through an AV fistula. So an AV fistula is something that we as surgeons construct, where we do a small surgical procedure and we join together some blood vessels. We don't put anything artificial inside normally, which over a period of 1.5 to 2 months allows the blood vessel to become big and available to be used for dialysis. So when your fistula is ready, a process we call maturation, at the end of that, you can achieve dialysis by just putting a needle into the blood vessel like you do when you're drawing blood for a blood sample, doing the dialysis and then taking everything out. So nothing artificial is left in the body. Globally, this is the first choice for dialysis for patients where it is suitable. There are other techniques which involve a graft and peritoneal dialysis also, but there are much fewer number of patients who would actually use that. So I hope this gives you a useful overview of what dialysis is and what an AV fistula and the options are. Thank you.